innovation, you need to put government policies in mind. Are the policies going to help you at this time? Is it going to help you in the next 1 year? Is it going to help you in 5 years? How do I bring government in to be partners, just so that this is going to help me moving forward? And also, whether we like it or not, Nigeria is increasingly becoming a religious society. We or not, then it means that we need to also look at the religious space. Many of the issues around mental health, around the health-seeking behavior, can be solved when we engage with the clerics. Why? Because these people have a lot of followers. So imagine if we decided to do something that can bring the clerics into our inclusion in the area of our health tech innovation. We want to look at the socioeconomic status, the policies, and the ownership of it. Let me move on. So eventually, it's safe for us to finally conclude that inclusion is about us. The next slide, please. That inclusion is about us. Inclusion is about the innovators. Next slide. Inclusion is about us, the innovators, the governments, the investors, the health systems, as it were, and the people that are going to probably be the beneficiaries or the users of the products and services that we are bringing on board. How have we been able to include everyone? It means all of us participating, bringing something onto the table, whether in terms of listening, whether in terms of giving, whether in terms of feedbacks, whether in terms of evaluation. We need to be able to do this. And so it's safe for us to say that inclusion I am, because we are. So looking at how much have we done in this area of is the fact. So please, next slide, please. I'm almost wrapping up. So this is the Ubuntu that I'm talking about. It's a matter of Ubuntu. So now the big fact, the next slide, please. We need to understand that inclusion is about mutual relationships. So you have seen the gap. It's also that the people that are going to use it have to key into the dream. They have to buy the product. They have to accept the product. There has to be social acceptance. It's not just enough that it can solve all health issues. If it is not convenient for me, which is one of the areas where I think the health insurance scheme, in terms of health tech insurance, health innovations, health insurance with respect to technology, is missing it. You cannot say you want to adequately, help with financial inclusions, and the people that actually need the financial inclusion are out of the space. Whereas we have people who are already doing this sort of financial inclusion through thrift. The thrift collectors, for a lot of us that grew up in Nigeria, we will know people that they call alajos. They collect thrift. Can we leverage on these people to be able to promote financial inclusion in Nigeria with respect to health insurance? So eventually, inclusion is not just assuming that some people are vulnerable or they are not going to probably have, so we need to think on their behalf. We may just be missing a big point, because they also have their own peculiarities, they have their own needs, they have their own thoughts, and they have their own trust system. And we need to take in all those things when we are factoring our intervention. Inclusion is about mutual relationships. Next slide, please. So I ask everyone here, next slide. So I ask everyone here, how ready are we for this relationship in Africa? It's a question I want us to go with. Whether you're an innovator, whether you're coming in as an investor, whether you're coming in as the platform for linkages, the One HealthTech hub from the international circle is here. Whether you're coming in as a facilitator for interventions, how ready are we for relationship in Africa? The last slide. The last slide. Last slide. Only that relationship is going to determine the sustainability of innovation. The last slide. Because eventually, whatever it is we are bringing on board in the area of technology and health, it has to be able to satisfy Ubuntu. I am, because we are. Thank you very much.
Thank you so much, Dr. Balogun, for that brilliant presentation. Anyone who knows you already knows, like, they can expect something dispassionate anytime you talk about relationships, communication, and research in health tech. We are really glad that you did this. Any members of the audience who has a question from Dr. Naima, please type a question so she can quickly take them before we move on. Thank you. Please type your questions in the chat box. Or you could just drop a comment so we give us some feedback before we go on to the next speaker. Hello, everyone. We're waiting. We'll leave a couple of minutes for that. Questions or comments for Dr. Balogun?
I guess you can move on. If the comments come in, I'll probably answer at the end.
All right. Thank you. So we're moving to the next part of our presentation, and we're welcoming Dr. Wale ADEOSUN. He's been here. He's around with us, and he's a health management consultant and a digital health entrepreneur with over 8 years experience in health service delivery. He is the CEO and co-founder of WELLVIS Health, a health tech startup that offers online consultations for patients and anyone seeking health information. He and his team recently developed a COVID-19 self-assessment tool, which has since been adopted by the Nigerian Center for Disease Control. Welcome, Dr. Wale ADEOSUN.
Hi, thank you very much for having me. I appreciate the invite. So I think I'll just get into it, and I will try to share my screen.
Okay.
But someone is still sharing their screen, so.
Okay, we're going to stop that now.
All right, great.
Okay, yeah, you can go on.
All right, thank you. One minute, please. Great. All right, so I'm going to be speaking about the innovations in healthcare and then the current trends in Nigeria. And I will start by saying, what is innovation, particularly in healthcare? Innovation in healthcare is often associated with new technology, but that's not always the case, as we all know. Innovation simply means, solving problems by using new, better, or more effective solutions. And sometimes it doesn't always involve technology. In simple terms, innovation in healthcare simply describes new policies, new systems, new technologies, new ideas, new services, or new products that provide new and improved solutions to existing healthcare problems, particularly around efficiency, quality, and affordability. And at the end of the day, what we're trying to say about innovation is that innovation is the creation of a desired future. If you want something, you have to innovate to get that thing to happen. Innovation basically is how you improve what presently exists and how you define what you want it to be like. Innovation creates new, values for people that are taking part in whatever product or solutions that is presently existing. So why is innovation important in healthcare? I mean, I'm sure every one of us on this call right now has one way or the other been affected by the inadequacies and inefficiencies of the Nigerian healthcare system. So I wouldn't even bother, going into details into that. The inadequacies of the Nigerian healthcare system is broad and is significant. However, the pandemic has brought a lot of these inefficiencies to the forefront, and it has shown the enormous need for innovations within our systems. Specific reasons I might want to add for why innovation is necessary and it's important is, if we start by saying, looking at the cost of healthcare delivery in Nigeria, the inefficient supply chain management for healthcare products and consumables. You find out pharmacies are saying they haven't gotten a particular medication yet because they haven't delivered it or they haven't supplied it. There's also limited access to, healthcare workers, to genuine drugs, to mental and sexual health services. There's low uptake of health insurance. The quality of care that we receive is of questionable quality. And of course, there's the growing population and then the increasing prevalence of chronic illnesses. What this means is that as more people are diagnosed with diabetes and hypertension and other kinds of chronic illnesses, there has to be a way that we can manage them, that we can monitor their healthcare, we can deliver healthcare services to them, healthcare products to them, without them having to end up at the hospitals, without them having to, crowd the hospitals and make people that actually need urgent and acute care have to wait longer. Particularly the cost of healthcare delivery. We all know what it's like. Majority of Nigerians, a huge percentage of Nigerians are only a sickness or one illness away from, from poverty. We also know that the limited access to all these services is also a huge problem. And these are some reasons why we have to be innovative. When we talk about healthcare, we have to find ways and manners in which we can deliver the products and the services to help improve healthcare delivery. So what are types of innovation in healthcare? Innovation typically can be grouped into technology innovation, and that way we'll be talking about AR and VR, we're talking about 3D printing, we're talking about wearable tech, we'll be talking about robots. We've all seen all sorts of robotic surgeries, we've seen telesurgery, we've seen all sorts of, those are all technology innovation. However, there's also IT innovation, and that's where digital health comes in, telemedicine, remote monitoring, data analytics, AI, IoT, and all those kind of things are where we see IT innovation. There's also business innovation. If you run a business, if you run a healthcare business, it's important that you're innovative so that you can be more effective, you can be more efficient in your service, in your delivery. And that's where lean management comes in, group practices. We've seen where a number of doctors are like, you know what, let's all come together and buy one big machine so that we can drop the cost of the amount we're charging our users. An example of that is if you see maybe 3 or 4 hospitals come together to buy one MRI machine, rather than all the hospitals buying their own MRI machine. What that then returns, or what that means at the end of the day, is that the MRI machines at these different centers, or the people that need MRI scans at these different centers can go to one place. The cost of the scans at that one place will be significantly lower than, that's an innovation. There's also service innovation where you improve service design and service delivery at your center. You start to be innovative around making patients the center of your facility, and also delivering high quality care. However, for this presentation, my focus will be more on IT innovation and particularly on digital health. So what are the innovations in healthcare and what are the current trends in Nigeria at this point? So the Nigerian health tech landscape. We understand that innovation takes a different journey from ideation through to design and finally to the general public. When you get an app on your phone, when you get like a new service delivery, when there's something new, trust me, it has gone through ideation, it has gone through design, and sometimes they fail design, they go back, and they can do this journey multiple times before it actually gets to the general public. And we understand that this journey is not easy. However, it can be made harder or easier by factors such as the market size, the rate of adoption of similar products, and the presence of policy or frameworks or regulatory requirements. Just by those factors, it's automatically clear that the Nigerian health tech founder or an innovator is disadvantaged, because you know that there's no policy framework, there's no regulatory requirements. Also, the fact that a huge number of Nigerian populace are living under poverty or living in poverty, what that means is that the adoption rate of your solution is significantly lower. However, some examples of innovations that we've seen in the Nigerian health tech landscape, I've sort of divided them, and then we can go through them and take some examples. So EMR. EMR, that's the electronic medical or health records. They aim to digitize health data. And why are they doing this? Or what's the hope, or what do they hope to achieve by digitizing health data and health records? By doing so, it's possible to then potentially transform the medical practice and improve the overall efficiency of quality of care at a reasonable cost from the data, from the insight gotten from such data. When you digitize health records, you're able to analyze, you're able to poke at this, you're able to find out more information, you're able to, you know, work with that data to get insights, and those insights that you get can then influence policy, can then influence healthcare delivery, can then influence cost of delivery of those services. And that's why it's important. And that's why people like Helium Health, Eclat, or Thalamus, all Nigerian companies, are working hard to deliver solutions and be innovative within this space and sector, so that digitizing Nigerian health records can be a success. Also, telemedicine and telehealth. That's also another area or a sector within the innovations in healthcare that has significantly grown over the past couple of months, thanks to COVID. Around the world, the pandemic has already improved the use and uptake of telehealth solutions, from remote patient monitoring to teleconsultations to virtual care delivery and many other digital health products designed for patients and providers. Usually, when patients don't have access to their primary care physician, they start to realize that these digital alternatives that exist are quick and easy to use, and they can give them the immediate help and reassurance that they need during these times. Sometimes they just want to be sure that what they're doing is the right thing. I know this for a fact because I run a telemedicine platform called WELLVIS. And on our platform, we've seen people who come just because they want to be sure if the medication they are taking is the one. They want to get second opinion. They want to know what to tell someone. They want to know how to convince someone to speak to a therapist, to speak to a doctor. And there's so many use cases that we ourselves had not even thought about when we set up the platform. But Nigerians are using the platform in multiple and different ways that has shown that this platform, or not necessarily our own platform, but telemedicine and telehealth as a whole, has come to stay. And then for medical, another innovation that we're seeing is in medical logistics and the supply chain management. Right now, we all know that the logistics and supply chain management for pharmaceutical or medical supplies and devices and equipment is unreliable. Medical logistics is an important part of the healthcare system. They are responsible for delivering drugs to the pharmacies, to the hospitals, supplying medical supplies, getting devices and equipment to all of these hospitals and facilities. And sometimes, because of the systems that we have in Nigeria, which is, a much bigger thing than just the healthcare space, has also seeped into the healthcare space. And startups like LifeBank are working within this, are trying to be innovative, or have been innovative within this medical logistics and supply chain management, and are designing ways to reduce cost and wastage, or even accessibility to all of these services and products, while they're still, running a business as well. Another interesting sector that I'm also very particular about, and I've seen a lot of work that is being done in Nigeria, is in the pharmaceutical sector. Various innovations have been created to address, simplifying drug procurement and making it easier for pharmacies to manage their operations. We've seen innovations from how drugs are prescribed to how drugs are delivered. Do you know that right now you can order for over-the-counter medications from your house and it'll be delivered to you? And that's even the small bit of things. Startups like M-Pharma, MedSac are bearing the cost of hospitals, pharmacy departments. They are running it from their own end, using innovative solutions, using technology to ensure that the drugs are constantly available, that they are not gone past their expiry dates. And these are some of the innovations that exist within the pharmaceutical sector. Additional points that I would like to see and like to make is that I'm hoping to see more innovations that leverage digital and mobile channels to scale up chronic illnesses and infectious disease screening and treatment options, with the intention to reduce disease burden in Nigeria. We have always been known to be a country with a lot of infectious diseases, but right now, a lot of other diseases are coming around that are not infectious, but they are chronic, they are long-term, and we need to find ways and solutions. For example, WELLVIS built a tool, like Dr. Miriam said earlier, for the NCDC. And there are ways. Right now, we're having conversations with different partners on how to design that same tool, but for other illnesses, for things like tuberculosis, for things like hypertension and diabetes, and how to help them through the solution to manage their illnesses, to know when they've taken their medications. And we're in talks with different partners to design those solutions. And we're expecting that and hoping that more innovators can come into the field and design these tools and create these tools so that the disease burden in Nigeria can be significantly reduced. Another notable mention, but it's not a big it's not a big occurrence in the Nigerian health tech space right now, is AI. AI in health is growing across the world, and in some ways, the Nigerian health system can benefit by, AI can be used to support early diagnosis through image recognition, MRI, CT scans, and skin lesions. In America, it's been seen that if an AI reads some MRI, they are usually faster and more accurate than when humans read it. So those kind of things can help us to prevent wrong diagnoses or faster diagnoses. It can also be useful for medical research and to discover new drugs. AI can process a huge set of data to quickly identify the right drugs that have the highest probabilities for success. When it comes to clinical decision support, AI is very useful, and it can facilitate decision making and improve processes and diagnosis when you're speaking to a patient. It can help to improve the skills of a doctor when they're clerking their patients. And also when it comes to another way AI can be useful in health is through the Internet of Things, by connecting wearables for real-time monitoring. So when you've got your Fitbit and all those Apple Watch and all those kind of things, it can have an easy access to your doctor, or your doctor can have easy access to your solution, to your data, and be able to provide clinical recommendations, can provide what you need to do next, and can tell you that, okay, at this point you need to rest, or at this point you need to take this medication, or you need to change your dosage. By creating all of these things, the AI can provide and increase the ways that we access healthcare services in Nigeria. I think at this point, this is the last slide, and thank you very much for listening. If you have any questions, I will be glad to take them. Thank you very much.
Thank you very much, Dr. ADEOSUN. I'll be going through the questions I think I'll start with you so that we can move on to the ones that are directed at Dr. Balogun. All right, so the first question directed to you is, Dr. ADEOSUN from Vincent Faseyosan, do you envisage a future where AI and new health tech innovations render doctors irrelevant?
All right, Sigyn, I don't think that's going to be possible. I don't think that's going to happen. AI and data and health tech is supposed to provide support to doctors. It's supposed to, for example, I will use what we're doing at WELLVIS. WELLVIS is providing a digital first approach, not trying to replace the need to go to hospital, what we're trying to do with WELLVIS is, you've gone to the hospital, you need a second opinion. You need to get pharmaceutical drugs. You need to check like your drugs if they're compatible, things like that. But I don't see AI at any point in the near future, changing in any way. It can significantly, for example, there are not enough mental health specialists. AI, if it's well trained, can start to be a form of triage to people who they need to speak to, the kinds of doctors that they need to speak to. But to completely replace, I don't see that happening anytime soon.
All right. Thank you very much. There's another question from Lisa Murphy. She says, she has a lot of questions, that's okay. How are the NCDC or other parts of the health system working in partnership with innovators? Are these mostly Nigerian companies or international ones?
All right, all the companies that I've listed here, they're all Nigerian companies. I was very specific about trying to make sure that I use Nigerian startups and people doing work within the Nigerian health tech space, so that we were able to see what is going on and not be discouraged by the fact that we might have some ideas or some innovations we're trying to develop, and wondering or worried that we cannot develop those solutions. There are people that are doing a lot of work. And if I might do a quick shameless plug, Digital Health Nigeria is also available to have conversations and support and point you in direction. If you're an entrepreneur or even an enthusiast, you can find us on social media and join this growing community of health tech enthusiasts and entrepreneurs, so that you can find out ways to develop some innovations if you're interested in doing those. How is the NCDC and what did you ask again?
How is the NCDC or other parts of the health system in Nigeria working in partnership with innovators?
I'm being honest. Let me see. Is this group closed so that all the potential government? But it's really difficult. I know what we had to face before we were able to get NCDC on board with our solution. Unfortunately, we were trying to sell the solution to them initially when we started, but when they were not even interested, we decided to offer it for free. And that's how hard it is, because for us, we had already built this tool, so it was easy to offer it for free. But as an innovator, there are other things that would have come into cost of production for your product or for your solution. And a lot of Nigerian members of the health systems might not be willing to pay what you deserve or what you think you need to pay, you need to get for that product. However, there's been a lot of collaborations between private institutions, between two private institutions rather than between public and private institutions. It's a bit harder when it comes to health tech, but there are people that are, navigating it, but it takes long, and there are people that are navigating those routes and eventually getting something out of it.
Thank you so much. We have to move on, but I'll just take just the next two questions quickly so we can move on to Dr. Balogun. Someone is asking, Mr. Bankole Samuel is asking, what's the percentage of adoption rates for WELLVIS telemedicine platform?
That's a very difficult question to ask, because percentage of what over which population? Again, I'm not going to be bragging about, there's a high adoption rate or not. There isn't a high adoption rate. We're growing the numbers. And a lot of the things that we do is still back to education. A lot of Nigerians, or a lot of people in general, don't trust different platforms and don't want to pay for different platforms. So we need to ensure that, we continue to educate people that these are the same doctors they will meet in the hospital if they went into the hospital, having a conversation with them. And sometimes it's important that you go into the hospital. We're not going to try to convince you to not go to the hospital for acute pain or anything like that. What we try to do on WELLVIS is to create access to non-critical, primary care. That way, non-acute primary care, that way it's something that, you've got eye discharge, what should you do? Or you've got, belly ache, what should you do? And we can tell you, after the doctor has spoken to you, that you need to go see a doctor at the hospital, or you need to get a test or a medication. And these are some of the things that we do. But to answer that question specifically, I can't give you a percentage, but it's a growing number. And we've seen a significant growth over the past couple of months, thanks to, again, COVID and Corona. And it's growing every day, but there's a lot of work that needs to be done when it comes to educating the general populace. All
right, thank you. Last question, and then we'll move on to Dr. Balogun. From Samuel Akinsende, how do you manage the cost and rigorous process of navigating through ethics involved in access to health data?
All right. Really, there are no policies that cover a lot of these things, or there's no implementation of them. So navigating to getting health data is different from, a lot of times you have to create and find your own health data rather than trying to get access to it through an IRB or through a different kind of platform. That one is long, that one is expensive, but there are ways around it. What you need to do is, if you have to go and generate or take your own research, your own data yourself, you have to do it. Whatever you need to do, if there are some states that you're trying to get into, for example, if you're trying to get into Lagos State and it's long, you can look out on those states, or look at the Ekiti State, or go to Kano State and get some of this data, so that at least you can make some, inferences from that data to kind of guide you towards what you're trying to build or what you're trying to get or use that data for. Yeah.
All right, thank you. So someone is you're not going to answer this one because we have to move quickly, but I wanted to just mention that Dr. ADEOSUN in his presentation had already discussed electronic medical records in Nigeria and how it is a growing industry. So I think that answers that. Thank you very much for your questions. We'll move on to that for Dr. NOIMOT Balogun. Dr. Balogun, are you still with us?
Yes, I am.
All right. So Tola Ogundipa is asking, Dr. NOIMOT, you mentioned the need to make health inclusive. I completely agree with you. How do we make it inclusive at an affordable rate and grassroots enough to make accessible to those who need it the most?
I can't seem to hear you. Let me check it.
Can you hear me better now? Can you hear me better now? Sorry, there's some rain here. Can you hear me better now?
Yes, I am. Yes,
okay,
I can.
so let me quickly take the question again. You mentioned the need to make health inclusive. I completely agree with you. How do we make it inclusive at an affordable rate and grassroots enough to make it accessible?
Okay, let me try and see if I can check the chat myself.
Okay, I will.
I'm trying to check the chat myself. I'm feeling here. I can't find it again. But if I got you correctly, I think you were saying something concerning grassroots inclusion. Hello, Dr. Toy. Hello.
I think she's out. The network on her end.
Okay, I'm finding it. I'm finding that too. If I got her correctly, I think she was asking a question concerning grassroots inclusion. Am I correct? So I can just move on to it.
How can you make it affordable?
Okay, affordability and inclusion for the people in the grassroots. Okay, so I've seen that. Thank you. So what I think is using WELLVIS, I mean, I just talked about WELLVIS, and incidentally, we're not just meeting here. So using its own, the platform that is working on that, has already been adopted by NCDC as a very good example now. So whether we like it or not, somebody has to be able to pay for people at the grassroots, whether it's either they themselves paying or someone paying on their behalf. If someone is going to pay on their behalf, the person has to understand the need and the benefit. At the same time, if they are going to pay, there has to be a sense of social access regards. So there has to be a very high level of public awareness program. So like I said, I'm just using WELLVIS as an example now. Imagine if we're looking at WELLVIS and the fact that they are doing primary health care. So it means it can be primary health care at the level of the child, of the the women, the men, and the elderly. Now, for a lot of the elderly people who work, who are relatively retired, a lot of them have children that understand the value of technology. So we could kind of like decide to engage the elderly people. For the ones in Nigeria, for a number of our elderly people, there are specific programs that they tend to listen to, specific programs that are tuned to elderly people. So I give an example for the Yoruba population. There's usually a news channel on radio that a lot of elderly Nigerians who are from the Yoruba origin and heritage listen to many times. Imagine engaging these people at this level and understanding that, what it takes is just for you to be able to call and have have the opportunity to speak with a doctor who can then, listen to you and if possible, refer you to the appropriate, health facility. It's as simple as that. If we're going to be talking about the formal working space, apart from, some people, whether we like it or not, they are not app inclined. They would rather. So we need to be able, like I mentioned earlier, for us to be able to have that financial inclusion, we need to understand who we expect to pay. If it is going to be donors, the public, the government, then we would channel this discussion of engagement to these third parties. If it's going to be the people themselves, then we have to meet the people themselves at the points where they are. Many of them are on Facebook, many of them are on Instagram. We can even find them on community radios. How many times are we engaging these people through those kind of programs? So I think it's basically leveraging on existing social networks that can improve public awareness.
Thank you very much. The follow-up comment to that question is that Tola says that this is bigger than we can determine in one program or centers. However, through this kind of program, it's possible to begin brainstorming and gathering data to build a sustainable solution in future. And I think that ties back into many of the points that have been raised. One last question for you, Dr. Balogun, from Shoyemi Rorufat. How do we make health general to everyone, especially in Africa?
Okay, so for health to get to everyone in Africa, one most likely the best way that we have now is through technology. Now, the only difference is that the technology is not going to be different for the different, the different class of audience that we're expecting. So if we are having the same, so I still go back to the WELLVIS solution. So if we're having the same WELLVIS solution, it can come in as an app for the formal community in Africa. I mean, i.e. people that are, the you and I that are in different workforce. The same WELLVIS solution can then come in as simple as a simple, oh, you have this issue, call this number and we'll be able to tell you this is what you should do and this is where you should go to. This means that we'll probably now have, other health facilities that are their partners around the different communities that these people can go to as a form of referral. If you're going to talk to people that are in between, they are not so educated, at the same time, they are not so, like they are not elite, they are not people that are not learned, we can begin to say, okay, can we just have them come in through a simple WhatsApp discussion where, so I think it depends on, so eventually you can take it across to every part of Africa, but then the solution will be based on the different audience and the peculiarities that they have. Thank you.
Thank you. Thank you very much. Thank you so much. We're really happy to have this invigorating discussion from both of our brilliant speakers who are both in their own spaces, leading exceptional changes in the healthcare sector in Nigeria and scaling up to Africa. Thank you so much. We're privileged to have had you today. So that will be the end of the Q&A. We'll be going to announcements soon. So if you want to join us, first, how can you join us? How can I get involved in One HealthTech? I've been hearing about. So Ibadan is one of the hubs in the larger One HealthTech community. So if you want to join, us, you want to join any other community where you find yourself within the One HealthTech network, just log on to the OHT website, which is One HealthTech at onehealthtech.com, and update your information. To one, subscribe to the OHT newsletter. You can also receive updates from the hub. You could also choose to become a hero or a mentor. Try and follow us on Twitter at OHT Ibadan. You can see the spelling right there on the screen. You could also register to become a hub member using this link and join the OHT community Slack workspace. So we'll be moving on to our upcoming events. You could just project that. Our upcoming events are the next event we're having. We have 2 events coming up soon. The first one is in London, and it is about, could you project that, please? So our first event is in London, and the next one is in Manchester. The first one in London is on 30th of September 2020. And it is about protected characteristics and data sharing in health and care. So it's good that we're having 2 members of this hub here today. So it would be really nice the way they've come from London to support us. Lisa and Gabriella, thank you so much for joining me from London. Please, as many of us as are here, let's reciprocate that support and join their own event. It's on 30th September. You can find more details about it on OHT website, One HealthTech website. And then the last event is going on is involving health and care, bringing NHS experts and health entrepreneurship. It's holding in Manchester on the 5th of October, 2020. So if you follow us on Twitter, follow us on Twitter so you can stay abreast of all important information. Thank you. So let me just read the final comments. Okay, Lisa says, fantastic event. I'm looking forward to welcoming you to the London event on Wednesday. So you see that's our queue. Let's register for this event. I will spread the love to everyone. You would like to say, I'll leave the floor open for Vivian, my co-lead at Ibadan, to give the vote of thanks. Thank you. All right, Vivian.
Hello, everyone. It's been an amazing ride. Can you hear me?
Yes.
Hello, everyone. All right.
Yes, I can hear.
So I'd like to really appreciate our speakers, Dr. Balogun. Thank you for that insightful section on inclusion in healthcare. Also, I'd like to thank Dr. Wale Adeosun. Thank you for giving us deep insights into the trending innovation in healthcare in Nigeria. Thank you so much. And I also like to appreciate everyone who joined us all over the world, our sisters, Paul, everyone from Nigeria. Thank you so much. And I'd like to stay updated on our upcoming events. Follow us on Twitter as well and join the conversation. Thank you very much. Have a wonderful day. Bye.
Bye, everyone.
Thank you.
Thank you.